We do have a Jennifer Coolidge impersonator with us.
I don't know who that's be.
I don't know either. All right. So, the cardiovascular system is not just the heart. That's the main component of it, okay? So just like your car, if there's no gas in it, what happens? It doesn't work anymore, okay? Now, if there's something wrong with the fluid line from the gas tank to the engine, what happens? The engine's not going to do what it's supposed to do, okay? So think of the cardiovascular system in that aspect, okay? The whole system, it's a pump, okay? It needs to have gas or blood for it to work, okay? Circulation, perfusion, all those fun things, okay? If an area has either no circulation or a severe decrease in circulation, those functions around it are not going to work as well as they should, okay? For instance, we are going to look at the upper and lower extremities, okay? We're going to be looking for edema. We're going to be looking for hair distribution on the legs and on the arms. Now, typically when somebody is starting to have congestive heart failure, okay, the skin on their legs typically will start becoming more of a darker color and they'll lose hair on their legs first, okay? So all you ladies out there that shave your legs, you're just letting us all know you want to have heart failure. Just kidding, okay? But with that being said, if there's a decreased amount of circulation going to the skin or anything on the lower extremities, okay, what can happen if that person gets a sore or a puncture, a bug bite? It's gonna either not heal or take forever. Because if there's no blood flow, okay, there's no protein being delivered, so the tissue can't regenerate, okay, cause a scab, cause the tissue to come back in, even as scar tissue, okay? And that is what is called peripheral artery disease, when there's no circulation. You might want to write that down, PAD, okay? We can have peripheral artery disease or peripheral venous disease. Now, artery disease typically happens on the outermost or lateral portion of the bodies. So it would be something along the lines on the outside of the leg versus on the inside. That typically is venous, if it's more medial, towards the center part of the body, okay? Now, what's wrong with this picture? This person's legs are asymmetric, but what do you think's going on? Poor circulation leading to edema, okay? Now, it could be related to circulation or it could be lymphedema. I couldn't really tell you, but the main purpose of this is that there's something going on with this left leg, okay? Lymphedema typically happens on one versus the other, okay? Whereas actual like cardiac edema, related edema, it would affect both, okay? Here's some other examples of some problems here. So over here we've got the thickening of the toenails. Now this tissue is all nice and dark red. Is that normal or expected? No. What color is this actually though? Kind of like a purplish color. If you look at it too, you can see petechiae all over. And that tissue is actually being strangulated because it's not getting enough circulation and not enough perfusion through the tissues, okay? Which has led to the thickening of the toenails and the poor skin, how it's all dried and cracked, all right? Then over here we've got some nice little varicose veins. You see all those bumps? Those are all varicose veins. Those aren't supposed to be there, okay? So, come on now. You're so sensitive today. I charged it overnight, so now it's like, I'm ready to work. All right. So, after all that we've been through, okay, what would you think would be expected as far as skin temperature on a patient with cardiac disease?
Probably decreased.
Probably what? Decreased? Okay. So that would be what? Cool? Clammy? Maybe? Okay. What about the texture?
Dry.
Dry, possibly cracked. Okay. Turgor?
Decreased.
It's gonna depend. If they've got edema, it's gonna be severely decreased. Okay? Depending on how far their edema is. Because remember, a couple weeks ago we had the 1+, 2+, 3+. All right. If they have just acute, what's called anasarca, they are not going to be able to. That skin is going to be like a tight balloon, to the point to where it could literally split and that come out and open. Okay. Moisture? Probably not. The skin's going to be really dry because, again, nothing's getting to those tissues to keep them nutrient enriched. Capillary refill? Meaning, when you say slow, longer than 3 seconds. Okay, we already talked about it. Okay. What is the meaning of if you say so? That is not what I said, but thank you, Sherry. All right, we talked about edema, we talked about arterial pulses. Do you think those are going to be easy to palpate in the lower extremities? No, definitely not, because if they've got a lot of edema, you might have to, what we call pushing past the edema. So you might have to push into that where the pitting edema is to feel a pulse, but you won't see it. That could be, upwards of +4 or 4+. Okay. So here's a nice little pulse going on in an area that we probably shouldn't have one. Can you guys tell where this is? Oh yeah, now you can. But do you see that right there? Nice little pulsation. Do you think that's normal or expected?
No.
No, that would be an example of a bounding pulse. Okay, we want a 2+ pulse expected. Obviously, we don't want a 0 because that means either we can't feel it or there's no pulse. Even after we've Dopplered it, that's when we get to say that there's no pulse. Okay, 1 is when it's really thready or weak, and you can, over time, you'll be able to really tell, like, wow, that's a really thready or weak pulse. Okay. 2 or 3 is okay, but we definitely do not want 4.
Would we ever see 4 if they're exercising, or even then it's still too much?
If they are currently in exercising mode, you probably have that. But if they've come down and they've relaxed and they're not active, like after 20 minutes,
okay,
after they've done their cool down, they're on the treadmill, it should not be bounding at that point. Okay. All right. You do need to know all of these pulse points and how to assess them. Okay? Know their location. Temporal, do we really use that very often?
No.
No. I mean, sometimes when someone's really pissed off, you can see that one, doing that number, right? But we really don't palpate that one. But carotid, brachial, radial, femoral, popliteal, where's that one? Behind the knee. Posterior tibial, and then dorsalis pedis. Okay? Now, we talk about the popliteal, but do we really assess it very often?
No.
When would you?
When you're gonna do a popliteal walk.
No. We don't do that as nurses. Nice try. Any ideas? Laura? Correct. So you might not be able to palpate a pulse down here on these 2 spots, okay? But you still have to make sure there's blood flow to that area. So then you would, if this is the leg that's broken, you would palpate the popliteal and not down here, okay? You still have to know, I mean, of course, as far as the order is concerned, okay? Talked about that. Talked about a Doppler. When do you use a Doppler?
When you can't feel it.
When you can't feel what? Okay, perfect. All right, here's some examples of some wounds. Okay, so this is a nice little, would this be venous or would this be arterial? Why venous? It's towards the center. Okay, and that's assuming that this is that portion. Yeah, also not a whole lot of blood. It's not very red, not good looking. Okay, what about this? You guys know what this is right here? Gangrene. That's extreme necrosis. When the tissue is turned black like that, there is no turning back. We cannot save this tissue. The only thing that's the best thing for us to do is cut it off.
So just what I've heard, does gangrene spread even if I've heard of people that have gone into like cold areas and gotten gangrene on their fingertips or something like that, like from being excessively cold.
Oh yeah.
Yeah, and even if treated, like if they were to heat the hand, would the gangrene still spread, or how would that? I just don't really understand.
If they were to, well, typically what happens even in a cold setting like that, the nerves and the tissue is so far damaged that they usually have to amputate.
Okay.
The only thing that I've ever heard of possibly being something that would work would be leech therapy, where they would put leeches on the tips of the fingers and by the active sucking of what leeches do, bringing the blood through there and getting those nutrients, they might be able to restore it. You'll see that a lot too if they're having to, like somebody cut their fingers off or something, they would do that to help with, again, with those super small vessels within the finger to get the blood going through so they don't actually lose the finger. You don't get to see leech therapy very much anymore. You know what else we used to do for pressure ulcers back in the day?
Leeches.
No, worse. We used to put raw sugar in them to attract the flies, so that way they would lay eggs and then the maggots would eat the dead tissue and automatically debride the tissue out.
And you witnessed this?
We actually still do use maggot therapy. You have to get them from the pharmacy. We don't do the raw sugar anymore, but you actually have to get them from the pharmacy and you have to count how many you're placing them in. You leave them in there for an hour or two and then you have to take them out. And you have to count how many you've taken out so that way you know you've got all of them. Everyone's like, I'm not hungry anymore. All right, chest pain. Now, it is the most common heart attack symptom, but as I've told you already, not universal, okay? The big thing that you need to remember when it comes to chest pain is what you do to treat it, okay? And there's a reason why good old Mona Lisa over here is dressed as a nurse, because that's a nice little acronym for you, okay? Now, there is some debate over the effectiveness of oxygen therapy, but for now, Mona, morphine, oxygen, nitroglycerin, and aspirin. Those are the four main things that we utilize to treat somebody that's having cardiac-related chest pain, okay? Morphine makes them feel a lot better, let me tell you, okay? But one of the side effects when somebody is relaxed and not having pain is it causes vasodilation, which allows more oxygenated blood to get to that part of the heart that is being deprived of oxygen, okay? Oxygen period, again, that's gonna increase the amount of oxygen that's in the blood to get that oxygenation to the tissue, okay? So that way they're not having to work so hard to breathe and get those respirations going, okay? We're trying to lessen the amount of tissue death with this, okay? Then we have nitroglycerin. Those are those, it is roughly the same thing, but it doesn't cause an explosion, okay? Little itty bitty tablets, they go under the tongue or sublingually. They melt and they go across the membrane directly into the blood supply and they go right to the heart. And those actually will cause the vasodilation as well, okay? Aspirin is the only one on here that doesn't cause the vasodilation. What it does is it keeps the blood from getting sticky. It is what's known as a antiplatelet aggregator. So instead, like when you have a clot or a scab that forms, that's typically all the dead white blood cells that they cause, like, you know, what's that stuff that you use on the wall with holes? Spackle. Become like a spackle thing to cause the bleeding to stop. Okay? The reason why we're giving it here is we don't want the bleeding to stop. We want to keep the blood flowing. We don't want the body to recognize that as an infection or anything and send white blood cells to clot everything up and cause that to get worse. We want to keep the blood flowing through it. So that's why they give it the aspirin. Okay? All right. Now, we've already talked about postural hypotension, okay? One thing to remember too with the elderly, cardiac output, of course, is going to decrease. How long have you had your heart for? Your entire life, even since before you were born. Usually, I want to say by what, week 6, if memory serves me right, is when the baby starts to having its own heartbeat. Moms, correct me if I'm wrong. When was it the first time you heard your baby's heartbeat in utero? Huh? About week 6. Okay. Now, how do we figure out cardiac output? It's the heart rate times the stroke volume. What's stroke volume? Stroke volume is the amount of blood that is pumped with each squeeze of the heart. Okay? Now, because in the older adult, their heart muscles have weakened, or they might not be as strong as they once were, okay, that's going to cause their cardiac output to decrease, okay? There's other things as well. Cardiomegaly, you guys ever heard of that? An enlarged heart or left ventricular dysfunction can actually cause that to go down as well. Because specifically with cardiomegaly, the heart, it's nice to have a big heart, but not physiologically, okay? Because what happens is the muscle gets thicker with that and decreases the amount of volume that that ventricle can hold. So therefore, the cardiac output goes down and the heart rate goes up, which only perpetuates it, because what happens when you do more reps at the gym? You get bigger muscles, okay? All right, so health promotion when it comes to the heart, yearly screenings. Guess what I get to do in a couple of weeks? I get to go for a stress test. Son of a... Be all patchy like the 40-year-old virgin. You think I'm kidding? Man, I asked them when the first one, I was like, do I need to, like, you know, trim or anything? And they're like, oh no, we'll take care of it. And they left me literally patch, 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 patch. I'm like, I could have taken care of this for you guys. All right. Exercise. What is the optimal amount of exercise somebody should be getting every week?
It depends.
Depends on the type of exercise. Okay. About 150 minutes per week of moderate exercise. Okay. That's 30 minutes a day. I could say you were wrong, didn't I? Okay.
No, in my head, I was thinking, I was like, oh,
Right. Stress education. Stress reduction. Okay. I know everybody in here is probably stressed out of their mind because they're in nursing school, right? That whole, you know, which orange is the most orange stuff. You're like, this is right? What are you guys doing to relax? She's like, alcohol, pizza. No. But seriously, what are you guys doing? Well, we know what Mason's doing because she's laughing, but come on, it's okay. Work out, okay, exercise, what?
She said alcohol.
She said alcohol. Who said alcohol? Well, I know. What else though? Do you guys have hobbies?
I
No, watch. Say
Say it one more time. I still can't hear you, hon. I'm sorry. Sudoku. Okay. What about Wordle? Some people enjoy. I don't like Sudoku. What? See? Okay. What about over here? Cause y'all are kind of quiet today. Kenny, what do you do? Chill out. He's like, I can't talk about that in class.
For real?
Yeah. Do you go to the movies? Do you read a book? Do you go out to dinner? Cook?
Yeah. I did last night for like 4 hours.
Guys, you're so secretive. My God, you might think I might think that you're human or something.
And I did like 3 different things.
Nothing.
Okay. Dietary changes. Okay, I might not look like it, but I have lost some weight in the last year. Not as much as I would like. But I'm also not eating fried foods all the time. Okay. I have all but eliminated red meat from my diet because that will increase your cholesterol. So I'm eating more of a plant-based diet now. I will eat chicken and I will eat fish and turkey, but no pork, no beef. And let me tell you, I miss like kielbasa sausage. Don't miss hot dogs. Blech. But like bratwurst. Oh. So good. Bangers and mash, you guys ever had that? You never heard of bangers and mash?
No.
Girl, where you been? Okay, you know you go to the grocery store and they have those big little bratwursts, okay? They sometimes like Johnsonville or whatnot. Yeah, they're kind of like, they're shaped rather inappropriately. Okay? But you cook those and then you pour like beer on them after you brown them. And then let them steep and cook the rest of the way, and then you make a side of mashed potatoes. Oh, so good.
So it's beer brats and mashed potatoes?
Yeah, bangers and mash.
Yeah, like
British thing.
Weird.
Yeah. Anyway, can't do that. Actually, I can't even do mashed potatoes anymore because of the butter and the cream. So if I make, I can if I have to make it. So yeah. I know. I've had riced cauliflower, which I'm not.
That's gross.
I'm like I'd rather have rice thing. Yeah. No. See, that's the thing. I don't. All right. Tobacco cessation. That was actually really easy for me to do. I've been smoking for a long time, but you know, having a heart attack kind of puts your things into perspective. Okay. Most of the time, for most people that smoke, it's the oral fixation and the habit. Like the hardest thing for me was first thing I would do is I'd pop in the car, shut the door, grab my cigarettes, light up, start the car, and then drive. And breaking that habit, it was like, oh, there's something I'm missing, that I'm forgetting to do. Here's what you know what I mean? So, but now I'm like, the money I save from smoking, I'm actually doing other things with. So, hey, all right. All right, so we have, this is one of the last 2 slides. You guys have almost made it. Pat yourself on the back. Left-sided heart failure, okay? Remember, I said earlier that left-sided heart failure symptoms are going to manifest in the lungs, not just the left lung, both lungs. Unless they've had the right removed. No, I'm just kidding. Okay? But look over here. Okay, they're going to have paroxysmal nocturnal dyspnea, meaning hard time sleeping. Okay, because they can't breathe. Remember I told you earlier when I had my heart attack, I laid down and I couldn't breathe? That's what that was. Okay? Restlessness, confusion. Why? How is that something that would deal with the lungs? Lack of oxygenation. Because if the lungs are filling up with fluid, they're going to have to work harder to breathe, and if they still aren't able to breathe well enough for their body's demands, they get confused. And when people get confused, they get restless. Okay? Besides, have any of you guys ever had a hard time breathing? Yes. Well, you get really anxious, don't you? Yeah. Okay. I saw you, Hunter. You're like, yup. Which I found an article about pneumothoraxes, and I automatically thought of you. Now, elevated pulmonary wedge pressures, you don't need to worry about at this point. We're not going to ask you about that because you have no understanding of central lines or anything yet. Okay. Cough, crackles, wheezes, blood-tinged sputum. What else happens for a patient who has blood-tinged sputum, typically? I know some of you guys in here should know. Hemoptysis, yeah, that's the other term. No, not bronchitis.
What was
Tuberculosis.
Should know.
Okay. Orthopnea, meaning that they are having to constantly be in that tripoding position to even get their breath. Okay. Patients with COPD, you'll see them leaning. If they're in a wheelchair, they typically will lean their elbows on the sides of the wheelchair and lean forward, and they'll have the oxygen on, and then they'll do pursed lip breathing where they're like that. Okay. Tachycardia for obvious reasons, exertional dyspnea, and of course cyanosis. Okay. They're going to talk about feeling tired all the time. Okay. If they're like my mother, drink nothing but coffee all day long. Which, not that I'm complaining, but you know. All right, right-sided. This again, they can complain of fatigue, but that's a similarity between the two. Because again, the heart is a muscle, it's a pump. Either side of it getting overworked, it's gonna cause a person to get tired. But the main thing that's different here is all of the other symptoms are affecting the rest of the body, okay? We have possibility of ascites. Do you guys remember what that is? Correct. Buildup of fluid within the abdomen, okay? Now earlier, someone was like, well, why is it that it's the right side of the heart affecting the rest of the body? Because that's going towards the lungs, right? You gotta remember, the heart is pulling and sucking the blood into the heart and pulling from up this way. Okay, typically. I mean, yes, there's the superior vena cava as well, but it's still having to pull that blood up. And because if it's not able to pull that blood up effectively, the blood sits in those tissues for a little bit longer and causes it to leach out into the tissues. Same thing coming this way, because this is pulling the blood from the lungs, and because it's backing up that way, it's collecting within the lungs. Okay. They might complain of anorexia or just not feeling like they're eating. They just don't have an appetite anymore. Okay. Again, that could be related to the ascites as well, putting pressure on the stomach. Swelling, the main one that you will see is the swelling in the hands and fingers and dependent edema in the lower extremities. Now with all that fluid buildup, what do you think is going to happen when they get on a scale? Their weight's going to be elevated. Okay, because that is stuff that's in their tissues and it's just retaining. Okay, it's not leaving. All right, as far as documentation for a cardiac patient, you want to make sure that you are noting the cardiac rate. And it says here rhythm. For right now, you just need to be able to say, you know, it is currently at 76 beats per minute and a regular rhythm. Okay. Once you guys learn about the different ECG tracings with the electronical conductivity of the heart next semester, then you would need to say, you know, is it sinus, is it atrial fib, you know, what the actual rhythm is, okay? Document the size and location of the PMI if it's visible, and the presence of any lifts, heaves, or thrills. Describe the heart sounds, which are supposed to be what? Love dove, or practitioners call it S1, S2. Okay. Document whether the client has a pulse deficit. Do you guys know what that is? We haven't talked about it.
When this pulse is more
different
this
from
pulse.
This pulse is different than this pulse. So, when you're calculating a pulse deficit, you have one person, or if you're having to do it by yourself, measure the apical pulse for 1 full minute. Okay? You take that number into consideration, then you measure, or the other person measures the radial pulse to see if there's a difference between the numbers. If there is, and the patient has a pulse deficit, there's a circulation problem. They might have a blood clot brewing. Okay. Document the presence or absence of JVD, which is what? Jugular vein distension. Note capillary refill, which should be less than 3 seconds. Document any peripheral edema, where it is, and how much. Okay, so if it's in the low, if it's lower right extremity, then you would say, then tell if it's +1, +2, +3, or 2 millimeters, 4 millimeters, whatever. Okay, and then describe the peripheral pulses, which would be, normal or expected. Pulsing would be what? What number did I give you for that one? For bounding is 4, but expected 2 or 3. Okay, perfect. All right, any questions? No? Am I that awesome? I can give you the test right now.
If we got the answers.
Well, I did give you the answers. I just didn't give you the questions. All right. Next week, we have another exam for this class on the 20th. Okay? So we all got to be here when? Aim for 7:45. Okay? I will be publishing the test this weekend. So keep an eye out for that. And then we also have another test for 2:15 next Friday in the afternoon. All right. Yes, sir.
I'm sorry, can you go over peripheral venous arterial disease?
Oh, peripheral vascular disease?
Yeah, uh-huh.
Okay. So what part of it?
Like you showed that wound and you were like, is this venous or arterial?
Uh-huh. This one?
Yeah, is that what I'm talking about?
Correct.
Okay.
So this is a vascular wound. Okay, this one's more related to the vein rather than the artery because we've got the deoxygenation of tissue here. If it was arterially related, it would be very red. And more towards the outside. This is more towards the inside of that extremity. Any other questions? You guys just like, ugh. I can show you some more ugly pictures if you want. They're like, no, we're fine. Oh my gosh, we are half an hour early again. Yes, sir.
What kind of math should we expect for?
Aha. A little of everything we've done so far. Okay, so expect to use, IV rates, weight dosages, or excuse me, dosages by weight and ranges, drip factors, everyone's favorite. Okay, so a little bit of everything. All right. Now, while we're on the topic of the medical math, oh, I didn't have you guys sit in yet. Your test is already, you already have the dates for that, right? Give it to you guys?
Yes.
Okay, good. 20 questions, you have 45 minutes. If everybody passes the first time,
Margarita party?
margarita pizza party. That's the type of pizza I'm ordering.
Whoa.
With margarita?
Margarita pizza.
Oh.
You ever had a margarita pizza?
No, with margaritas.
Oh, no. And I would love to. Just not on
Okay.
campus. We'd have to meet somewhere for that.
The parking lot? Parking garage?
The parking
Bring my
garage.
blender. Where's the campus boundary?
Right.
Is it the building?
As far as the eye
Yeah, and
can
then just
see. You
pass it
see
by.
that shadowy place over there?
You could tailgate in the garage.
Ah! We'd have to get extra pizza for the security guard. But, okay, but yeah, it's gonna be a little bit of everything that we've done as well, but it's the 20 questions, okay? If you do not pass the first time, One, your fellow classmates will be very upset because then there's no margaritas or pizza. You have a total of 3 attempts, okay? That test is in 3 weeks. We're finishing up week 7 right now. We have week 8, week 9, week 10, and then the test. Okay, so please make sure too that you are working on those modules within ATI and uploading those, because I looked before I came in. Y'all need to get your butts in gear with that. There's dosage calculation modules within ATI with exams. And not a lot of people have been turning those in. And you have, on that, you have until the 30th. Because I want you guys to have those turned in prior to the test, so that way if there's any last minute questions, concerns, we can go over those. Okay? So please get on top of those. Also, just as a side note too, when it comes to lab and getting checked off, you can get checked off by either myself or Professor Reed, okay? Apparently somebody told Professor Reed yesterday that they didn't want her to check them off, and I'm like, yeah. There's 2 of us in there for a reason, okay? So please, just make sure that you are getting checked off, because I already gave you guys an extra week, and if you noticed, I gave you guys an extra week for Shirley Williamson, because you guys were all having problems with ATI, so I extended that to the 16th. But all of your checkoffs and stuff, I mean, we're both master's prepared nurses, we both can check you off, okay? Let me think if there's anything else. Oh, there will be a Kahoot. I'll probably put that up during lunch today, okay? All right, I'm trying to think if there's anything else. Group 2, don't forget to bring your stethoscopes tomorrow, please. You will need them tomorrow for lab.